Hi, Andrew with the CPAP shop here. In our last video, we talked a little bit about BiPAP therapy, what it is, how it's different from CPAP, and who can benefit from it. In today's video, we're going to be taking a look at two of our most popular BiPAP units, the Philips Respironics DreamStation Auto BiPAP and the AirCurve 10 VAuto BiPAP from ResMed. Before we jump in, if you find the information in this video useful, please click the like button and subscribe to our channel. We do our best to provide viewers with helpful tips and information on their CPAP accessories, equipment, and supplies. To quickly recap the last video, BiPAP stands for Bilevel Positive Airway Pressure. It provides both inspiratory pressure, IPAP, and expiratory pressure, EPAP, to treat severe cases of obstructive sleep apnea and, in some instances, central sleep apnea. A BiPAP requires a specific prescription from a licensed physician. Let's take a look at the DreamStation Auto and the AirCurve 10 VAuto BiPAP machines. Both units deliver IPAP and EPAP between 4 and 25 and are compatible with any CPAP mask. Some patients with higher pressure settings may find nasal pillow masks a bit uncomfortable. Both units include a travel bag, an AC power supply, standard tubing, and a year's supply of filters. The AirCurve 10 VAuto comes with an integrated heated humidifier with the option to add a heated tube at checkout. The DreamStation Auto does not include the humidifier, though it can be added later on. Additionally, both units can be used with a backup power supply, such as a CPAP battery, though some units delivering higher pressure settings may require a double battery configuration or an alternative power solution. For more information about CPAP batteries, contact our customer care team. If you're familiar with the DreamStation Auto or AirSense 10 Auto CPAP units, then the functionality of their BiPAP counterparts is pretty similar. To begin therapy, make sure the device is plugged into a known working outlet and press the start button. The motor will begin and air will begin to flow through the tubing to the mask. Much like an auto-adjusting CPAP, these units are designed to increase or decrease air pressure throughout the night according to your needs. Both units provide patients with a ramp feature, the settings for which can be accessed through the My Options menu on the AirCurve and the My Setup menu on the DreamStation. Ramp is a comfort setting, allowing users to fall asleep at a much lower setting than their prescribed pressure. As the user falls asleep, the pressure will ramp up to the prescribed amount. It can be set to a specific time between 5 and 45 minutes, or it can be set to automatically adjust as the machine senses that you fall asleep. If you're using the humidifier on either machine, those settings can be accessed again through the My Options menu on the AirCurve or the My Setup menu on the DreamStation. If you need to adjust the humidity level, simply press down on the dial knob and then turn it until the desired setting is highlighted, then press the knob again. Both machines are able to preheat the humidifier, allowing it up to 30 minutes to get warm prior to the beginning of your therapy. Humidifiers are ideal for patients living in a dry or elevated climate, or for users who experience chronic dry mouth or sore throat. To clean your humidifier, carefully remove the water chamber from the machine. Simply pinch and pull on the AirCurve or press the tab on the DreamStation and lift the lid. Rinse any excess water from the chamber and wash with warm, soapy water. Some water chambers are top rack dishwasher safe. Let it dry completely before reinstalling. This step should be done daily. Because of the severity of sleep apnea that BiPAPs often treat, it's important to track how effective your therapy is. That's why both machines come with compliance reporting. To view sleep data, select the My Info menu on the DreamStation Auto or the Sleep Report menu on the AirCurve VAuto. From there, you'll be able to view information such as AHI, or the number of apnea events you have throughout therapy, mask leak data, number of hours used, and more. If you have a smartphone, you can view more in-depth reporting with either the My Air app for the AirCurve or the Dream Mapper app for the DreamStation Auto. Both apps are compatible with iOS and Android devices, and the machines are Bluetooth equipped to make syncing with your smartphone app easy. Additionally, data is stored on an SD card on both machines, on the left-hand side of the DreamStation and on the right-hand side of the AirCurve. Filters are an important part of maintaining your BiPAP machine. They prevent dirt and dust from collecting and entering into either machine parts or your tubing. Filters should be inspected regularly and replaced when damaged, discolored, or wet. To access the filters on the AirCurve, look for the vented panel on the left-hand side of the machine. Pull the panel open to inspect or replace the fine filter. The fine filters for the AirCurve are disposable and should be replaced every month or as needed. The DreamStation comes with two filters that are accessible on the left-hand side of the unit. The light blue fine filter is disposable and should be replaced every month, while the darker blue foam filter can be replaced every 3 months. The two DreamStation filters must be used together. Line them up like so and connect them. We understand that living with sleep apnea can be challenging. BiPAP therapy is an effective tool that can be used to help reduce your symptoms and get the sleep you deserve. If you have any questions about the Philips Respironics DreamStation Auto or ResMed AirCurve 10 VAuto BiPAP machines, give our customer care team a call. We can be reached at 866-414-9700, or you can reach us by email at questions@thecpapshop.com. I'm Andrew with the CPAP Shop, and as always, thanks for watching.